Amanda Tulk, Chief Science Officer at Extraol, highlights recent case studies featuring how to set up a successful radiotherapy skin practice.
The use of superficial orthovoltage treatments for non-melanoma skin cancer, and actually a wide range of clinical indications, has been well documented in textbooks and articles. What we have at Extraol now is we have a really nice series of case studies that are being put together by Professor Gerald Fogarty. One is about how to set up a good radiotherapy skin practice. And what he's done, as he's based in Australia, is he's brought together a group of radio-oncologists to just really look at how do you set up a really good skin cancer service. And they've kind of looked at three different aspects. One is, what does a good skin cancer practice look like? Do we know our patients? What treatment modalities do we need? What stakeholders do we need to consider? And actually really important, what's important to our patients? What's the outcomes? How do we involve them in the prescription decisions that we're making? The second part is really looking at who else is involved in skin cancer care. It's looking at the stakeholders, and that can be anybody from the referring GP to the nurses that help with any skin reactions that the patients may have, to even involving the carers of these patients, especially if they're elderly and going back to a nursing home. It's really how do they disseminate the information. And what they're trying to do is bring together everybody who really needs to know about skin radiotherapy for the benefit of the patients. Of course, in Australia, they have one of the highest incidence of skin cancer, but really what they're setting up here is a formula that really the rest of the world could follow. What does good care look like?